Hi, it's Dr. Janowski for Sonata. Today we're going to talk about something very basic, very simple, just a Dysport treatment for lines and wrinkles in the upper face. Dysport, as you may know, is the equivalent of Botox. It's just a different manufacturer, makes basically the same thing. It's a botulinum toxin type A, just like Botox. I prefer Dysport and my patients do, for three reasons. One, it's less expensive. Two, it lasts a little bit longer. And three, it kicks in a little bit quicker. So the vast majority of my Botox patients have now moved over to Dysport and they prefer it, and very few have moved back, although there still are some people who prefer Botox. But they're essentially the same thing, and I hear all kinds of crazy stories about people getting these treatments and having all kinds of problems. It's really, if done technically well, there's really very little that people should be complaining about. Most people, the most common thing is they didn't get enough, so they're still seeing motion in those areas. Small bruises are possible, but quite minimal. Very rarely people will complain about heaviness of the brow. So we want to keep really a very light dose on the forehead, and in some cases we don't treat the forehead because we don't want to push the brows down. So I'll just show you how I do it. It's very quick and easy. Most people say that they barely feel it when I do it, and I'll just show you how it's done. Okay, so this should be really a very simple, straightforward procedure. We use a very tiny needle. It's actually an insulin needle. It's pretty much the smallest one they make. We go across the brow to get the lines that form in the middle. And then let's raise the brow like a surprise and relax. So again, I like to go very light on the forehead. I don't want to push the brows down. Raise up high again and relax. Very small amounts here. And then we will do a little bit to give the brow a little bit of a lift. Very small. And then we'll turn a little bit this way. We'll do our crow's feet, make a smile face, and relax. So we just put these tiny ones right in here. And we'll do the other side. Quick smile and relax. So there's no need to prolong the procedure, make it a big production. We just wipe the patient down. That took all of 1 minute to 2 minutes to do. Very often there's no bruising. We can see little tiny bumps where the fluid went in, and that will be gone in about 20 minutes, and most people can go right back to work, whatever they're doing. There are no restrictions. They used to say, don't lie down, don't exercise. You can do all of those things. There's really nothing that's ever shown to be a problem in terms of your activities after the treatment. So Dysport will kick in typically 2 to 3 days later, which is a little faster than Botox. Botox can be 5 to 7 days sometimes. So people appreciate that, and Dysport can last anywhere from 3 to 4 months. So it's as simple as that. So if you haven't tried Dysport, come on in and we'll give you treatment.